On the side view of a mammogram, this is what a normal mammogram would look like. There's fatty tissue underneath the skin, and then the glandular tissue is white, and the connective tissue are all these lines. So the normal mammogram will have these lines running through it. That's just connective tissue like a netting, and the glandular, the milk-producing tissue, is the white. On the other hand, a breast cancer is also white, and oftentimes it'll have a white area and will have these calcifications in it. And these you can see these calcifications. Those are suspicious for breast cancer, and that's what you can see if you step back here and look at the two. This is kind of evenly distributed, and this one has a lot more white right here. And also the other thing is this little BB right there is on the skin, and that's identifying that the patient felt a lump right there. The other view is the up and down view, looking at it from your head to your feet. And so this is the left side, the normal side, and that's the abnormal side. And the normal side has the skin, a layer of fat, and the breast tissue, which is the lines in the white, whereas the cancer side has a BB on the skin where the patient says, "I feel a lump here," and this white area is the tumor itself, which is accented by the calcifications there. Mammograms are the initial way we diagnose people, and another way is with ultrasound, and this is what an ultrasound looks like. Ultrasound is looking, it's as if you're looking right here down through the breast, from the skin through the fatty tissue to the tumor, and here, this is the skin here, that's the layer of fatty tissue, and this is the tumor here. And this is the muscle fibers here, right behind the tumor. And the calcifications are these little white specks there, which you only know if you're an ultrasonographer, but this is the tumor here on ultrasound. The most sophisticated way of looking at the breast is with an MRI. This is an MRI. The patient is lying down. Her right side is on that side. Her left side is on this side. That's the left side on this side. And a normal breast looks this way. This is a picture of looking at the blood flow in the breast. Blood flow runs in blood vessels. It also goes to the blood tissue, but it also goes to the muscle in the chest wall. In fact, this is all the chest wall, and the more blood flow is colored. So there's a lot of blood flow in the muscle and the heart and stuff, but we're not interested in this part. But if you look at the two breasts, it's very clear that one side has a big area of abnormality along with normal blood vessels, because cancers have much more blood flow going to them. And so the blood goes in and out of the cancer much quicker than it does in normal breast tissue. And so we can see it. And if we move the person in three-dimensional, these are blood vessels in the chest here. But if you move the person in three dimension this way, you can kind of get an idea where the tumor is, and you can kind of see where it sits. This is inside the chest. All the color is inside the chest. None of this is abnormal. But the only thing abnormal in the breast is that spot right there. The different colors are red has the highest increase, highest blood flow, green is the second highest, and blue is still above normal, but it's less than red. You'll see in the blood vessels, you'll see red. And if we saw the heart here, we would see red too. So this is just one of the ways you can get a view of where it is in the breast, and this is an MRI which is color enhanced, and that's a computer added identification of where the cancer is. So in this particular case, you can see the cancer is well away from the skin. It's inside the breast. If we were going to do a lumpectomy on this patient, we would identify. We would want to take that tissue out with a margin of normal tissue around it. So that's a kind of what the lumpectomy would look like, and you'd say, oh my gosh, it looks really big, but the breast is a three-dimensional structure. So there's breast tissue in front of us and breast tissue behind us, which we're not touching, only the tissue around it. And so you still can do a lumpectomy on lumps that are this big. You can see how much breast tissue is on either side, and if we were going to take it out with a lumpectomy, we'd do something like that. And then we still have some space under the skin. And we have new devices to adjust for the empty space there. But we would normally do a lumpectomy in that spot there and then give radiation to the rest of the breast so that any stray cell that might be there would be treated with radiation. And that's how we interpret mammograms.